Verruca or wart is a skin infection caused by human papillomavirus. This infection is quite common in younger age and also those with a lot of activities such as going to the gym regularly, swimming or playing football. Another group of patients are those who are immunocompromised, such as patients on immunosuppressive medication after organ transplant, or those patients with syndromic immunodeficiency, such as HIV or AIDS. Verruca can come back very easily if it's not properly treated. Verruca should be treated completely. The common places include those parts of the body which are mostly exposed to the environment, such as hands, feet, especially those people doing a lot of gardening with naked hands are at risk of getting it from soil. Or other people can easily transfer it to their friends or people who are in close contact with. Verruca can easily spread from one part of the body to the other parts, especially if it's touched or scratched or picked on. For example, kids might scratch it and then unconsciously scratch other part of the body and sitting verruca there. And that's why we can see a lot of patients with verruca around and underneath their nails, which is very difficult to treat. Verruca can be very difficult to get rid of. Another important point in treating verruca is that, especially in those patients who are immunocompromised, it can be misdiagnosed as verruca, and in fact it could be a skin cancer which needs more comprehensive and also prompt action. Verruca can be treated in different ways. The commonest one is to use the over-the-counter products, including Bazooka or Bazooka Extra Strength. When you're applying these products, you need to ensure to protect the skin around the wart with emollient such as Vaseline before applying the treatment on only the lesion. At night time, especially, it works better if you put it under dressing. There are lots of dressing over the counter you can order. One of them is called Duoderm Extra Thin Dressing. Please ask your clinician if you need more information about the products you can use available to you. The next treatment option is cryotherapy. Cryotherapy is either over-the-counter one, which is not very strong and most of the time not very successful, especially in cases of recalcitrant wart. In contrast, liquid nitrogen spray we use in clinical practice bring down the temperature to minus 150 or even minus 200 for a few seconds, and that interrupts the circulation to the wart and consequently kill the wart. The side effects of liquid nitrogen spray could be blistering of the skin, ulceration, which might take a long time to heal, and especially the extreme pain during and after the treatment. Sometimes, if it's not enough, it might not work completely and patient might need repeating the treatment. On the other hand, cryotherapy might cause significant damage to the skin, causing a scarring and even recurring of the wart. it is very important if you have any wart on sensitive part of your body, including around your eyes, to ensure to get it treated by a specialist to reduce the side effects and increase the efficacy of the treatment and ensure you are using the right treatment options. Another treatment options which is not very commonly used is surgery. Surgery, again, similar to cryotherapy, will end up with a scar, and also it might be with recurrence of the lesion. One of the appropriate options, which could be more accurate and associated with lower risk of recurrence and also lower risk of scarring and damage to the skin, would be ablative laser, most commonly CO2 laser ablation. It can be done after application of numbing cream, and that's what I usually use in my private practice. Another important point in treating wart is to reduce the risk of recurrence. Another treatment option we use in our clinic is photodynamic therapy. Depends on the type and location and the number of the warts, we can use photodynamic therapy as the main treatment option or as an adjunctive treatment to reduce the risk of recurrence. That's specifically very important to know. In multiple warts, there might be some microscopic sitting of the lesions which are not visible to the naked eyes, and they cannot be treated appropriately and consequently increase the risk of recurrence. What can be done with photodynamic therapy is to treat a large area of the skin. Photodynamic therapy has been shown to be with significant improvement in different types of warts on everywhere on the body, including face, genitalia, and hands and feet.